Why don't you have a seat over here, okay? And Cohn, Shane, you guys can come sit over here next to me on the other side. Okay, are we all ready? So we're here today to announce the filing of a lawsuit on behalf of the Hopkins family in connection with the tragic death of Robert Hopkins on March 1st, 2017. Many of you know about the circumstances that led up to his passing. But just to briefly tell you what happened, he was in the care of Valley Convalescent Hospital, which is a skilled nursing facility. That facility was charged with caring for him while he was admitted there since 2015. And over the course of the 2 years that he was present there, did you guys need some?
Yeah, there you go.
Is that, do you want me to just move it closer?
I think that's good. Yeah.
Is that good? Okay. All right. So, Mr. Hopkins was a patient at the skilled nursing facility, or lived at the skilled nursing facility for just under 2 years when he passed away. The event that immediately led to his death was one where he was on his bed in the facility, and there's a side rail that's supposed to be placed up when he's on his bed. He was placed kind of on his side, and the nursing assistant neglected to put up the railing, and she then left, and when she returned later, he had fallen and he had hit his head on the nightstand, and he sustained a very serious injury. And he was later then taken to the hospital that day, to the Mercy Southwest Hospital, where he was diagnosed with a fracture of his vertebrae, and remained in the hospital for about 7 days. And then he was diagnosed with the vertebra fracture, and was eventually, under the care of hospice, taken back to Valley Convalescent on the 28th, and then passed away the next day on the 1st of March 2017. As many of you know, the Department of Public Health came in and did an investigation in connection with this incident, and they determined that the conduct of the facility created a high likelihood that substantial or significant injury or death would occur by not placing the rail up and allowing Mr. Hopkins to fall. And as a result, they fined the facility $100,000 and issued a Class AA citation, which is the highest citation that they can issue. But that's not the whole story. And what this family is trying to accomplish by filing this lawsuit today is really to improve care in this community for elders, for our parents, for our grandparents, to prevent these types of tragedies from ever occurring again, to prevent any other family from having to go through what they're going through. And the reality is that when he came into the facility in June of 2015, the facility did an assessment, and they said, number one, he was at risk of developing ulcers, and number two, he was at risk of falling. He was identified as a fall risk. And there were precautions that were supposed to be put in place to prevent him from developing these sores and falling. But despite the fact that they made promises to the family, that they developed a plan to ensure that he wouldn't have these sores, to ensure that he wouldn't fall, over a two-year period leading up to the final fall, the records that we have from Valley Convalescent reveal that he fell 9 times. 9 times between June 2015 and February of 2017, which is when he had the last fall that ultimately was the final straw. Also, during that period of time, over a period of time, he came into the facility without any bed sores or pressure ulcers, but over a 2 to 3 or 4 month period in 2016, he developed a decubitus bed sore in the coccyx region, which is just above the buttocks area. And these sores are described in stages. So they can be unstaged if they're extremely small, not even really formed yet. They can go up to a stage 5, which is you see the bone. And because they neglected to turn him over and manage these ulcers, he went from unstaged when he came into the facility to a stage 3, and he was taken to Good Samaritan Hospital, where a doctor there said that they needed to immediately do a debridement procedure, and that was done, and he was hospitalized for a period of time. So the story of Robert Hopkins at Valley Convalescent is much more than there was this one fall that resulted in his death. The story of Robert Hopkins at Valley Convalescent is a story of neglect for 2 years while he was in that facility. And it's imperative that there's transparency associated with everything that happened to him while he was in that facility, because many of us in this room or people we know are in positions where they have to place their loved ones, their parents, their grandparents in facilities, and it's important that they have information about what transpired in this facility, because when a facility makes promises to do things for a family, and might I add, one of the things that really disturbs me is that his wife of 59 years, Patricia, was partially paying out of pocket for him to be in this facility. She was paying around $550 a month, and Medicaid was paying the rest of the money for him to stay in that facility. And certainly, they were not paying money to this facility with the expectation that the facility would then neglect him, abuse him, and cause his death. And so we're obviously disturbed over what happened, but I think it's been a little bit of time, and maybe to some degree we've moved past the mourning phase, and we're now in a phase of how do we create change? How do we make this better? How do we try to avoid these types of things from occurring again? And frankly, the Department of Public Health feels that if Valley Convalescent can't come into substantial compliance with things that they're expected to do as a skilled nursing facility, then they shouldn't operate as one. And that sounds harsh, but that's something that the state has said, and that's something that we believe in too. If they can't actually follow through on the promises that they make to family members and people who are in their facilities, then they don't have business fronting as a facility that purports to provide care to them. So let me give you a little bit of background about Robert. He was born in Arkansas, and he was 80 years old at the time that he passed away. He attended Bakersfield High School and served in the Air Force, was in the Korean War, and then returned back to Bakersfield and worked at Bank of America, eventually became a VP at Bank of America, met his beautiful wife Patricia in Barstow, California. They were married for 59 years. And with us today, in addition to his wife, are his daughter and son-in-law Shannon and Paul. He had suffered 2 strokes in 2011 and 2013 that caused some left-sided weakness in his body, but ultimately it was a stroke that he suffered in 2015 that left him hospitalized, where he had left-side weakness. He was a diabetic, and that required him to then be placed into a facility that could care for him. And that happened to be, or at least the family thought it would be, Valley Convalescent, and that was in June of 2015, and he remained in that facility from June until his passing on March 1, 2017. The lawsuit that we're filing today, myself and my associate Felicia Schofer, is a lawsuit that lists two causes of action. One is an elder abuse neglect cause of action. The other is a negligence cause of action. And let me focus on the first cause of action for a second because I think it's really important. This state passed a series of laws several years ago under the Welfare and Institutions Code that were designed to protect elders and dependent adults from neglect and abuse. And they said when that kind of thing happens, these types of facilities need to be held accountable. And there are heightened remedies that come with this cause of action. It's a lot for us to prove it, but we think that this is a case of neglect. And there's no reason why he, after being identified as a fall risk, should have fallen 9 times over the course of 2 years, or just under 2 years. There's no reason after being identified as someone who could develop ulcers and sores should be hospitalized and have to go through a surgery because they neglected to turn him over and manage the bed sores. And of course, there's absolutely no reason why he needed to fall off of the bed that day. And they're very fortunate that his roommate, who was a close friend of his, witnessed it and heard him say, "I'm falling," and noted that the rail was not up. And one of the things that still disturbs me today is in looking at the Department of Public Health report, the nurse who neglected to put up the rail still says, "No, I put the rail up." And another nurse who came in after he had fallen said, "No, the rail wasn't up." And the roommate said, "I saw it very clearly, the rail was not up." So it's one thing to make a mistake, it's then another thing to not take responsibility, to deny that's what happened. Obviously, if the rail was up, he wouldn't have fallen. So we're here with heavy hearts, but with desire to create change. And we hope that this lawsuit will send a message not just to Valley Convalescent, but to other facilities in this community and across the state, that they have to put a premium on the safety of people who come to their facilities. And if they fail to do that, there will be consequences and there must be accountability. So with that, I'll take any questions. And if there are questions for the family, you're welcome to ask.
I saw you kind of shake your head as you talked about 9 times falling in that course of a couple years. Was there a time as you maybe be visiting him that you're understanding he's falling a couple times and maybe worry sets in at this hospital? What was it like for you as a family?
I was not aware of 9 times over the course of the last 2 years. My wife was contacted a couple of times when he did fall. And at that point in time, we'd go in and check on him. I was fortunate because I work at Bakersfield High School, so I was right around the corner, so I was able to go in and check in on him at lunchtime. And at no point in time was I worried of his well-being.
As his wife seeing or learning 9 times, what is for you?
I've seen 1 or 2 times, but they never notified me.
And one of the things that she can tell you too is that on the most recent fall that resulted in him passing away, they called her and said, "Well, he fell off the bed," and she said, "Oh my God, is he okay?" And they said, "Yeah, I think he's fine. He has a little cut above his eye, but he should be okay." Well, I don't think what happened is that he just had a little cut above his eye. It was only then after your daughter called you and said that he was in the emergency room that you knew it was more serious, right?
Right. And it was more than a little cut over the eye. It was also under his eye, and there was another one under that.
Were all 9 falls from his bed?
No. Some of the falls were from his wheelchair and some were from his bed. So it was a combination.
All the falls that were from his bed, do you know if the bed railing was up or down?
We don't know that yet. That's something that we hope to discover in the case. But also one of his legs was amputated before he came into the facility, below the knee amputation of the right leg, and so that was one of the reasons why he needed to be in a wheelchair. But I've been involved in cases where people do fall from wheelchairs, and a lot of times they slide out of the wheelchair and fall, and sometimes facilities in those circumstances will institute or mandate that a non-skid pad be put on the wheelchair to prevent that person from sliding out of the wheelchair. Whether they ever did that, they thought about that, that's something that we hope to discover over the course of the case.
With the last fall, do you know how long it took before the nursing assistant came back into the room?
I believe it was a matter of minutes. I don't think it was hours. But specifically how long after he fell that she came in, I'm not 100% sure.
Are these beds made in such a way that a person sitting in them or lying in them, they can't put the rails down on their own, correct?
Yeah, he wasn't able to do that. That's something that the nurses are required to do, because I believe it comes in from under the bed, and it's not something, if he has to go that way, he could fall.
Okay.
So he's not able to go and put the railings up. I don't think there's any dispute that it's the facility's responsibility and they're the ones who put the rail up.
Do you know if it's physically possible to fall out of the bed if the railings are up? Like, how high are these railings?
I don't know exactly how high they are. I think it's pretty difficult. I mean, you would have to try really hard. You would have to like jump over the railing or something to actually fall. But if what happens is if you're rolling, you're not going to fall off the bed if the rails are up. You would almost, you'd have to like get yourself over the railing and fall. But the reason they're up, or they're supposed to be up, is because people can roll off the bed, and it's supposed to prevent them from falling in those circumstances.
It was complicated enough to try to maneuver the railing up. I couldn't do it. I know he couldn't.
The nursing assistant that did not put his bed rails up that night, has she been let go?
We don't know. We'll find out. There's a lot of turnover, not just in this facility, but in facilities across the county. And that's something that we see as an epidemic in this community and really across the state, across the country with these types of facilities, is that the facilities are understaffed, they're undertrained, and there's high turnover in terms of the people who come in to work at these facilities and then who go on to work at other facilities and leave.
Do you know why there's such a high turnover rate?
Well, we have reason to believe that in many cases it's a corporate decision. The folks at the top decide that they have a put the heads in the beds model, which is we got to keep the beds full to make money. And so what we do is we fill all the beds and we try to be as leanly staffed as possible because we can make more money that way. And in some cases, it's been proven that they even have balance sheets where they say, okay, if we have only 1 or 2 CNAs here, maybe we should have some more, but we can really save cost. And if worst case, even in those circumstances, we have a lawsuit or two, maybe we have to pay X amount of money out, but still we come out on top. So that's something we're going to try to find out in this case, go up the chain of command to try and find out, are these corporate decisions? I mean, one of the issues, right, is that the CNA comes over to him and then she's called to go to someone else in the meantime and leaves him there and doesn't put the railing up, and that's when he falls. So how many nurses were available that day to manage how many patients? What's the patient to staffing ratio? One of the things that we have some suspicion about that Felicia looked at in the records is that a lot of the falls and a lot of the records get a little shoddy between 2 p.m. and 6 a.m. They're usually pretty good between 6 a.m. and 2 p.m. And we suspect that's because there's staffing shortages in the afternoon, evening, and over the night hours. And also there's not as many visitors and administrators around in the later evening hours. And so a lot of the time, the neglect, the dropping the ball, that happens at those times.
What did your husband and your father say about the facility? Did he like being there? Did he like the staff?
He liked his roommate. His roommate became his best friend. And he never gave warnings that he was being highly mistreated. I think that's a fair statement.
Yeah.
Now, in the almost 5 months since this happened, obviously there's the tragedy of the death, but having to deal with this as well as a family, what has it been like for you?
It's sad. It's shocking. And we worry for the people that are there. We worry for the people that have to go into a facility. You know, we have other parents and grandparents that we worry about. And what do we do? You know, what do we do? How do we fix this?
What's it been like?
Well, Shannon and I investigated the place before we put Dad in there. And we were disappointed in what we saw, but I thought, you know, there's nice people here. There's good people as well as probably some that aren't. But right away, I noticed that my husband wasn't getting the attention I thought he deserved. He needed help. He needed help to get into his wheelchair. He wore a prosthetic leg on his right leg, and all of a sudden they stopped putting it on. You know, why not? That's helped him. That's just an example of one little thing, but there was others. And it had been mentioned to me in the evening hours especially. They said, heaven help you if you need to get somebody here quick. They aren't coming.
And at any point, did that worry you that maybe you should pull them out?
Yes, I reported it. I went straight to the nurse. I says, and told them what my husband said. I says, I want this taken care of. If he needs help, he needs help. He can't turn himself.
But one of the other things I think that you alluded to is, if you were concerned, did you think about moving him out of the facility and into another facility? Well, there's two problems. First of all, a lot of these facilities don't have open spots. The beds are full. And so it's not like, oh, we have 5 or 6 other options, let's go try any one of those. The other complicating factor is that he was a Medi-Cal patient, and so only certain facilities are able to take those types of patients who have that kind of insurance. And you're already dealing with a limited number of facilities who accept that type of insurance for someone who comes into the facility, and there's a large population of people who have to be in those facilities. And so really what they were told at the time that he was admitted to the facility in June was really there was no other facility that could take him. So whether they had concerns, whether they loved the place, it's not like they were shopping. They were just told, if you want him in a facility, this is the only one that can accept him.
Have there been any other lawsuits filed against the home recently, or any other similar complaints that you're aware of?
Well, what we know of, and I think this was in the article, is that since 2012 there have been 23 other complaints against the facility. There have been 195 deficiencies identified over that same time period, 2012 and to the present, and $160,000 in enforcement penalties that they've paid. So whether or not any of those deficiencies or those penalties resulted in the filing of lawsuits against the facility, that I don't know, but I imagine that if those cases are filed here in Kern County, that's something that could be accomplished by going to the court's website and looking to see if other lawsuits have been filed. But we've been actively involved in a number of cases, not necessarily against Valley Convalescent, but other facilities in town. What I can say is that when I described it as an epidemic, I wasn't being facetious in any way. This is a problem that so many people face in this community, which is, how do we get the best level of care for our loved ones? And so many times these facilities, mostly due to understaffing and undertraining, are falling short of what they're expected to do.
If the home is insulated, as you've sort of mentioned, with their balance sheets, with low staffing, etc., insulated from the cost of lawsuits. What do you hope to gain with this particular suit?
Well, I think that the most important thing is educating people about what's out there. I think this family was in a position where they were kind of in the dark about what to do about, her husband, her dad, at a time where they needed help. They couldn't care for him at the home anymore. And lawsuits like this have the ability to educate people who are in similar situations about the potential risks of putting a loved one in a facility like this that drops the ball when it comes to providing services to people that they say they will do. So I think that's one part of it. I think the other part of it is accountability. It's that when a facility makes a mistake, a very serious mistake, over the course of 2 years, and that rises to a level of neglect or abuse, there have to be consequences, because if there aren't consequences, there's no incentive or motivation for that facility to change their practices or to go about business a different way. But if there's consequences, if there's accountability, the hope is that it will change behavior.
Is there a amount damage-wise that you're searching for?
No. There's some complicating factors in these types of cases. One complicating factor is that we have a law in this state called MICRA that was passed in 1974, which says that any lawsuits brought against healthcare providers for negligence, medical negligence, your non-economic damages, meaning the loss of love, companionship, those types of things, are capped at $250,000. Now, if we're able to prove elder neglect and abuse on the part of the hospital, there is no such cap on those types of cases, and also there's a provision that allows for the recovery of attorney fees. But I think the money is the last thing on any of our minds right now. I think we want change. We want this facility to acknowledge that what they did was wrong, and we want them to change their practices so this type of thing doesn't happen again. And if the case goes to trial at some point, it'll be up to a jury in this community to decide what's a fair amount of money to compensate this family for what they've been through.
Are you pretty confident that a jury will side with you? And when someone asks, this was a $13 an hour CNA that made one mistake, albeit a very tragic one, do you think you have enough evidence to prove this was an ongoing, consistent problem that the facility itself was aware of and failed to act on?
Well, we have 9 falls in 2 years, and we have someone who comes into the facility and is identified as a fall risk, and despite being identified as such, he falls 9 times, and he develops ulcers and has to have a surgery even though he's at risk for developing these sores and ulcers. So I'm confident that we'll be able to prove that Robert Hopkins was subjected to neglect while he was at the facility for the less than 2 years that he was there. And even if this CNA was paid $13 an hour and made a mistake, that's not acceptable to this family. It's not acceptable to us, and that's not a way that we can say, oh, it was just a mistake, it's okay, no big deal, it happens. Because things like this shouldn't happen. And there's more to what's going on here than meets the eye, which is it's not just one mistake by one person. This is more of a systemic problem, and we hope that we'll uncover some of the systemic deficiencies in facilities like Valley Convalescent through this case. Any other questions? Okay, thank you guys. Appreciate it. And there's copies of the lawsuit. I think George can email it to you guys as well.
Photos as well. I have an electronic form if you want me to send it to you.
Oh, you do?
Yes.
Okay.
Yes, he's got them in electronic form, so
All
he can get
the
you
better.
Yeah.
Yes.
That would be great.
Okay.